Hey, hey. Ladies and gentlemen, please welcome to the stage Ryan Howells, Principal of Leavitt Partners, David Warden, GM of Head of Healthcare Clear, Bob Speakman, Vice President, Chief Technology Officer, Wellstar Health System, and Priyanka Agarwal, Founder, CEO, HealthElix.
Hey, good morning, everyone. We were so excited to be on stage, we just wanted to get up here early. So this topic is so important to all of us that we wanted to make sure we had enough time to be able to review it with you. It's great to be with you. As you mentioned, I'm actually with Leavitt Partners. I'm a principal at the firm, been there for about 9 years. We do something really interesting. It was founded by former Secretary Mike Leavitt about 14 years ago, in that we focus on healthcare federal policy, and we try to find effective ways where healthcare federal policy could be enacted on a consensus basis between public and private sector stakeholders. What an idea, right? That's kind of pretty interesting. So we've been heavily involved in digital health and interoperability rules like the CMS and ONC rules for quite some time. We also work with CDC on public health guidance and rules that they are working on, FDA, VHA, and any other federal acronym you can imagine. But we've also done, and we'll talk about this here, an initiative called the Karen Alliance, which is focused on getting consumers more digital access to their healthcare data. We have about 80 organizations involved, including Apple, Microsoft, Amazon, all of these different big tech companies, but also small tech companies like Priyanka is going to talk about, all with the intention of how do we figure out a way where individuals can get more digital access through the use of these things called FHIR APIs. What does that look like to really start to engage the consumer? And we're going to talk today about how identity plays a key role in the consumerization of healthcare. So with that, I'd love to be able to have each of our panelists introduce themselves, I should say, as part of this, but I'm going to ask them a question, and they're going to introduce themselves and then hopefully be able to answer that question. So Bob, I'm going to start with you there at the very end. You look so far down. There we go. Bob, tell me about Wellstar's journey in terms of consumerism itself. Like, how do you, when we talk about consumerism, I know there's certain health systems that we go to and they go, well, we got Epic MyChart, we're good. We're good. But for you, it wasn't enough. You wanted to do more. And give us a sense of like, how does Wellstar actually view the consumer?
Oh, thank you. So welcome, everybody. It's a pleasure to be here today. So I'm Bob Speakman, Vice President and Chief Technology Officer for Wellstar from right here in Georgia. One of the largest health systems in Georgia. We have 30,000 plus employees, 11 hospitals, 5 health parks, so pretty substantially sized organization. So yeah, consumerism, the patient is the focus and the center of everything we do. So we wanted to see what else can we do? How can we make the experience better for the consumer? And to do that, we looked at putting their needs first. So we looked at how can we optimize their experience? How can we make things more streamlined? How can we do things without redundancy and duplicate effort? And one of the things we did to help achieve this is we partnered with Clear, and we developed a new process for patient check-ins, which uses Clear's technology and does facial recognition, complete biometrics, so that the patients can come in and actually just look at a kiosk or a tablet, and their facial recognition will check them in. All the information that they have behind the scenes, they don't have to enter anything into clipboards. They don't have to stand in line at the front desk. So it streamlines the complete process. One of the things we're talking about today is the digital native healthcare consumer. And this demographic needs immediate feedback. There's a sense of urgency, they want transparency, they want it right now. They want innovation, technology, and this is one of the things that we're doing at Wellstar to actually help in this area. They're driving the technology, they're driving the adoption of the technologies, and so we're trying to make it better for them. And so it's working very well. I think we're going to get into it a little more in a future panel discussion here, but that's one of the main things that we're doing, Ryan, to help.
Thank you, Bob. That was great. So, David, let's move to you, General Manager at Clear, General Manager of Healthcare, I should say, at Clear. I just know Clear because of the airport. Like I just go there, there's these really friendly people. There's always too many of them. I don't know, they just like attack me. Like they really want me to sign up for Clear, and I've already signed up. I'm like, I'm already there. I'm done. I don't need to sign up. I'm good. I'm a client. I'm a customer. But it's seamless, right? Except in Atlanta, you and I have talked about that. But it's seamless in the sense that we just get through Clear, and it's awesome because Clear already has my information. I look into the screen, and I am ready to go, and it's TSA approved, and there's so much goodness. But why healthcare?
Yeah, it's great to meet you all. My name is David Barden. I lead healthcare for Clear. Came on about 2 years ago to do exactly what we're doing here now and bringing Clear into the healthcare landscape. We've been in the airport for about 14 years, and the airport's fairly unique, right? It's a zero-fail environment, and I got a call from Clear. I've been in healthcare for about 15 years in total, and thought it was such an intriguing opportunity where there's a real opportunity to solve for the fragmentation that exists in healthcare. Thinking about just even my personal experience, I live in New York City, and I consume care all across a number of different care organizations, and my record just does not carry with me. And so when you think of the crux of it all, it's really all tied to the identity piece. But Clear is, really bridged itself outside of the landscape of the airport. We built a platform business, and so we power different experiences across a plethora of different use cases, everything from how you can check in, for example, for car rental or check in at a hotel. We actually work with a major local partner here in the Home Depot and actually power their rentals business and helping make sure that the folks that are actually renting the equipment are who they say they are and that they're actually returning it, right, versus losing that stock and not being available for the next person. Delta has been a major player and investor in our product, naturally with the airport business that we have. And we work with Wellstar now. Wellstar was the very first innovator to step in and say, hey, we really want to think about how we can power this ecosystem here in Atlanta. We know Clear has roughly, call it 1 million plus members just in this local area. How do we mobilize those members to have a more frictionless experience? And so we took a lot of our core technology that we have in the airport, we bridged it into their partner experience, and so we can do this through Epic, through MyChart, through Welcome, which is their check-in product. And it's been really tremendous and a lot to learn from. I will say this, right? Like different experiences command different levels of assurance, and I think there's so much when we think about just the patient journey, the consumer journey, everything from how we appointment schedule, where it kind of matters who you are, but when you check in, right, it really matters. And then when you pick up that prescription, it really, really matters. And we can effectively orchestrate that all behind the scenes and make sure that we can step you up and down that so-called mountain of identity. So really excited to be here today, share our story, share what we're doing in the landscape, and really how we're powering a really exciting journey for the greater Atlanta market.
Thanks, David. Priyanka, you represent the innovation economy, and specifically those third-party applications that are acting on behalf of consumers. So those of you all have phones. I'm glad very few of you are on them. But there are phones now where you can be able to look, for example, with Apple Health. And if you look at that heart icon, you can actually download all of your medical records to your phone. I don't know if you knew that or not, but it's happening. If you have an Android device, you can do that through Common Health, I should say. Or you could also do that through Samsung Health. So there is an actual plethora of options out there, and there's about 40 other apps that are out there too that can download your health data. Priyanka, you do something really interesting in terms of how you help consumers be able to federate their preferences from a privacy and trust perspective. Help us give an understanding of what you do for consumers.
Absolutely. Great to meet you all. My name is Priyanka Agarwal. My background, I'm a physician. Practiced for many years, still do on occasion, and spent time in the biotech pharma space. And, I was shocked as a provider that the status quo when you want to engage patients or when you want to access their data for a registry is you go to professional societies and they say, Priyanka, I can sell you data for any outpatient in the United States. And, my reaction to that was, well, my goodness, I don't think we're all getting our care with that intent in mind. And yet, the challenge that we have in healthcare is that if I want to go to, say, UCSF, where I still practice, and I say, well, I want to work with these patients and engage them in research, or I want to access their data, there's really no good system or way for me to ask patients beyond the incredibly high bar of formal informed consent that we all know is a paper process, maybe it's digitized, and it's slow and it's inefficient. So as a co-founder and CEO of HealthX, which I now started building 2 years ago, really what we're all about is this notion that trust in healthcare is more important than ever. And health systems that are able to build that trust are more successful in managing their patients, and patients ultimately want a voice in how they're getting their care. And alongside, we know there's this massive $100+ billion opportunity around health data, which is more important than ever for AI, for precision medicine, for any type of operational improvement. And really, what our sense is that many health systems are sitting out this opportunity because of these concerns around trust and because of concerns around security and compliance. And so what we're trying to do at HealthX, and really what our mission is to empower consumers, build trust, and to do this via our global consumer preference and consent management system that can be run at health systems. And we support health systems in incorporating the patient voice into their full range of activities, but more specifically help those health systems that want to embark upon doing more with their health data, but doing it with the patient's voice incorporated. And so, we think a lot about how can we make it easier to collect patients' choices? How do we move beyond everything being a binary yes, no, informed consent towards this massive breadth around, well, as a patient, what do you want? How do you want to get your care? How do you want to do things like support research or care improvements? We are able to collect those in an integrated experience for patients through MyChart. We're actually partnering with Clear to make it really easy for patients to onboard onto the service. And then from there, we support patients throughout their entire care journey. And then on the health system side, we can digitally enforce those preferences and consents so that rather than this being dark data that's collected on a clipboard, we can digitally enforce that and provide some assurance around, from a compliance or a data perspective, what's happening on the other side of these consents. And then for teams that want to make that data available, we offer secure data vaults to ensure that only the teams that need to access data are accessing them, and then we log who's accessing the data. So the end-to-end system then is incredibly consumer-facing, but it also supports health systems in their journey of how do we do this work in a way that's defensible, in a way that offers nuance, and that's ultimately simple and efficient.
So we're seeing a theme here of eliminating the clipboard. Doesn't that sound really fun? You may not need to fill out a clipboard any longer when you show up at a Wellstar facility or use Priyanka's tool because of what is being empowered here. So with that, let's get into digital identity, what it is, because I think for some people they get excited, and for some people they're scared to death, like this whole biometric eye scanning, palm reading, pseudo Star Trek stuff, right, that's going on, David? Help us understand why it's more secure, more privacy preserving, and more consent based than what we have today in healthcare.
Totally. So first and foremost, I think it's important to delineate, the pieces of kind of the landscape, right? So there's really two major areas, right? There's authentication and there's authorization. What Clear really focuses on, how do we streamline authentication across all the varying things where identity matters, where you need to effectively enter into an experience. It could be for a healthcare system, anything from a patient journey to a workforce journey, right? You're a workforce member, you're coming on board, you want to enroll, right? You have to go through that credentialing process. Could be a visitor who's looking to visit their loved one in a hospital-like environment. It could be a vendor who's coming on site to fix an MRI machine, right? In all of these cases, to some extent, there's a level of authentication that we definitively need to know who you are. And a lot of, I think, ways of misconception around identity is that it's just your driver license, but actually identity is much more rich than that, right? If you think about the consumer, you are your driver license, but you're also your insurance card, and you're also your HSA, FSA payment card, and all the context of how you think about the consumer journey. And what Clear is effectively doing is we're verifying you, right, to the most definitive data point possible, and ensuring that for that use case, right, with whatever use case it may be, that it's at the right level of assurance so we can effectively, tailor it up if we need to. And we're giving you the option of consent. This is incredibly important. I I think for everyone can get nervous about biometrics, right? But when you know what you're actually doing with it, that's the power of it, and that's the part that we really stand by, right? This is not an opt-out platform. This is a fully opt-in, and each and every one of our experiences that we power are fully opt-in, and so you can verify, right? You opt in, and then you know where your data is going. A lot of the practices that you've seen in the airport have been mainly focused around fingerprints and iris. We actually just went through a very painful upgrade across all of our airports to Face. So for those that are Clear members here and have had the opportunity to do that, I promise you good things are coming, and we will fix, hopefully, the Atlanta logistical issue here.
Yes, let's do that, right?
So you'll start to see some very exciting new ways where you will almost be in literally walking pace versus having to stand and go to an enrollment pod. So this will actually be rolled out in phases. You'll actually see this come in the very near future over the next couple months. So, but in short, right, like I think identity is so foundational to so many different experiences. Today, we actually announced a partnership with Uber, which we're really excited about, and it's really for rider verification, right? You think about even just something as simple as, you know, a rider who's getting into a car, right? The driver needs to know that that's a verified person and vice versa. So there's so many facets of our life where this really matters, and I like to think of identity as much more than just identity. It's identities with depth, right? In the context of healthcare, it's your health identity.
But you're the one who controls it. Really. You're the one who has it, you're the one who stores it, you're the one who's facilitating the exchange of that information, you're driving that process. So I think, and it's using not just healthcare leading edge technology, which that's probably an oxymoron in and of itself, but you are actually using the best technology on the planet because you are TSA certified, right? And the ability of going through, and like you said, it's a zero proof environment. So I think that's key for folks to really be able to understand.
100%. We have to have the highest level of certifications and really focus on our cyber infrastructure, right? If Clear were to have a cyber incident, right, that's pretty much the end of us. So we have the highest level of certifications. We're one of the very few government-based technologies that exist, right? So I think I like to say that like in most cases, right, with most technologies, failure is not good, but in case of Clear, failure is actually a feature. It's not a bug. It's because we probably don't believe you are who you say you are, and we will kick you through a flow that gives you an alternative path. So bottom line is, yeah, we have a zero fail environment in the airport, and we're carrying that same context to all the other varying places we exist in, like in healthcare.
So Bob, give us a sense of the patients who have come into Wellstar and have had this experience of check-in, right, where they're looking into a screen. What's been the feedback that you've kind of received to date, and what's been the experience of not only the patients, but your frontline registration staff?
Sure. So our journey with Clear has been tremendous. We partnered with them. It took about a year to develop the product and the workflow. We worked very closely with Epic, and they were closely engaged and helped building the solution because it ties directly into their Welcome solution. But it's been received very well. Initially, we just did a pilot at one of our health parks, so it wasn't a super high volume health park, but we've had over 1,000 people use it. It's been great feedback. The demographics of use has been a little surprising. I thought we'd have, the digital native consumer using it, but really the 45 to 54-year-olds are the highest users of the system. In the mid-60s, that age range is the second highest. And there could be various factors. Could be the type of services we offer at the health park, that community, and the breakdown of the age demographics there. But it's been they love it. They're using it, and what they're starting to give us feedback on is how can we optimize it. So how can we take it to the next level? What are additional use cases that we can use to market this even further? Some of the things we have planned are we're going to use it for password resets. We have 1.35 million MyChart users, and there's a lot of people that forget their passwords. So if they can reset them themselves, that's volume off of the service desk internally and so forth. We're also looking to leverage the Clear technology with our employees, not just our patients. How can we verify they are who they are when they call the service desk, or they want to do password resets themselves? So those are use cases that are definitely coming. Excuse me. Also, we're doing scheduling. 1 second. Patient scheduling through my chart is one of the next ones. And also the scheduling of non-scheduled appointments would be the last one we're really focusing on.
Yeah, and I'll just add, the results that we've seen to date are really impressive. I think one of the statistics that I was most excited about was the reduction in duplicate issues. So 95% of duplicates that would have otherwise come through were actually removed and averted, and that's tremendous, right? Both from a cost standpoint, but also from a patient experience standpoint. You can think about what that can mean downstream in terms of filing that claim and so forth, and having to deal with call centers. So it was a really exciting initiative. And I do want to clarify one important piece, right? When we talk about biometrics or facial recognition, we're not taking your face up against a bank of faces. We're actually doing a one-to-one match because we have some type of a unique identifier. It could be your phone number, it could be your email, and we're scanning your face, but we're matching it to that one direct image that we have on you on file versus taking it up against a bank of faces. And so that's some of the clear technology and what we've effectively built behind the scenes.
And I want to also reemphasize one of the things David said, because it's kind of a huge benefit that we received. The deduplication rate was 95%. And the previous process or workflow was we were fixing the deduplicated records. We were deduplicating after the visit. We're taking those and we're resolving them before the visit. So that ensures patient safety. The clinical team has the information they need to do the best job during that visit and so forth. So that's been a huge, huge thing because it's a very tedious process to deduplicate. So if we can front end that with a clear facial recognition, it's a game changer, and it's been very successful.
It's a crazy awesome statistic, right? Because that patient matching issue is an issue, and we can actually solve that by knowing that they are who they say they are. Priyanka, then when the patient comes into Wellstar, for example, theoretically, they're going to have this kind of mountain of paperwork, related to specific authorizations that they wanted to fill out. You guys are taking that the burden off not only the provider, but also the patient as well. Give us a sense of what are those things that are built into the system from a patient prior auth type perspective that you're kind of alleviating?
Yeah, absolutely. So, first I'll say identity is fundamental to the notion of consumer choice, consent, preferences. And so, every experience that we have with a patient, their identity is verified. And we can do that through the existing patient portals that they have, i.e. MyChart, or we can do it through our partnership with Clear. And certainly we see incredible benefits of working with Clear in terms of, you think about issues with passwords, remembering logins, and just moving to something much more seamless. There's also benefits from, we're getting a little technical here, but for things like 21 CFR Part 11 compliance, if we're using biometric authentication, we actually simplify the user experience for patients and for consumers, so you're not having to go through a double login. Once we have that identity captured, we work with patients, again, very early in their journey. So when they onboard into a health system, we ask them their range of preferences. We take them through the consents that they may have to sign to onboard to a health system. And what we can offer to the patient is, once they've gone through that flow once, we can store those preferences and consents and say, we know you get your care at this health system. We know that you're also going to other health systems. Would you like HealthX to store those preferences and consents for you so that the next time you onboard to another system for your care, you're not having to go through that process again? And that notion really enables this sense of federated identity, which is this notion that rather than me as a consumer or a patient having, my 5 different MyChart logins, I can then start storing those in one service, HealthX supported by Clear. And then when I onboard to new health systems, I'm not having to go through those notions again. And there's really interesting work we can do to support that where, obviously there's one version where the health system is accepting those preferences. There's another where we can just act in support of the patient on behalf of the patient. We can say, this is HealthX's sense of what your preferences were before. Would you like to apply these same ones to your One Medical login? Or whatever it may be. And so this notion of really supporting the consumer, but having all actions be based on identity, everything going through the patient. So rather than this notion of tokenization that happens for patient identity today, where you may have groups that are linking records without the patient or consumer's view, we can then take that practice, which is based on prediction, it's not patient facing, it's not consumer facing, and we can give all of that power back to the consumer, actually have increased confidence in how we're acting, and make the entire experience seamless for consumers and for health systems along the way.
It has been said the only constant in healthcare, I should say, is the consumer, right? And so they are the ones who are constant in terms of the entire flow. You're making this really institution, hospital agnostic, potentially payer agnostic, right? This idea of identity coupled with consumer preferences makes this whole process agnostic.
That's right. And certainly you think about data movement across payers. There's new regulations coming out from CMS that are requiring patient input so that, as a patient or consumer changes payers, their record follows them. And so having this preference and choice layer for consumers that is health system payer agnostic is incredibly powerful. At the same time, we want to make things better at the health system level. So this ability to toggle between supporting the enterprise, but also supporting the consumer is incredibly powerful. I think we're going to see more of this coming out in healthcare, and identity is obviously fundamental to that because you can't move between this layer of the enterprise and the consumer without this identity following you along the way. And so just incredibly excited for what's going to be possible. And moving past, I think, the experience we all have of managing your health system login, your payer login, your pharmacy login, and how do we move to something much more universal? And we view ourselves as that choice and preference and consent layer and can couple with providers like Clear for the identity layer.
So Priyanka, let's geek out a little bit on healthcare federal policy, okay? So maybe people are going to go to sleep at this point because this is the piece of this. But for those of you who don't read the thousands of pages of regulation like I do or others do in this room, we'll give you a quick synopsis. Number one, and this is a takeaway for hopefully every health system and payer in the room. It is now the law of the land that you have a right, based on the reason that you need the data, minimum necessary for HIPAA, to all of the claims and clinical information you need to either treat or provide operational or administrative services to that individual. If you don't have that data today, I would strongly recommend that you put it in your contracts tomorrow. With everyone you do. You ask for the US CDI API that is actually there that's made available from ONC's rules. For all of your lines of business, if you're a payer, you ask for that data, that FHIR API data tomorrow. And if you are a provider, you ask for that claims data using the Karen IG for Blue button that we created actually a while ago that's now going to be required by 2027 for to make this happen at scale. So payers and providers have the right to access that, but the good news is patients do too. Patients also have the access to their clinical and claims information from any, right now, CMS payer or provider in the country. So Priyanka, there's this thing called TEFCA. People have heard about it. What is this thing? It sounds like it's a spaceship somewhere. I don't know exactly what it is. Trusted Exchange Framework and Common Agreement. The quick answer to that is it's nationwide interoperability. It's the ability to connect one time and then be able to access your information from any payer or provider that's participating in TEFCA around the country. That's the dream. We have to get there. We have to get there. We have to figure out a way to make that happen. But give us a sense, Priyanka, if I'm a patient and I want to use your service to potentially access my records, part of that has to do with identity and consent and being able to then get on the TEFCA roadmap to be able to access that information. Give us a sense of how that works.
Yeah, so this is incredibly powerful for consumers. As individuals, we all have the right to get access to our data from our providers, from our payers. And this is under a service called Individual Access Services that TEFCA is now supporting. Epic recently came out with an announcement that they're supporting this type of data movement. So as a patient, I can take my data from wherever I receive care that runs Epic, and I can move that data to apps. And over time, as a patient, I can actually move that data anywhere. I can move it across providers. If I'm moving, I can take my record with me. And the user interface for this is incredibly important. And that's where we view Health Access coming in. We can act on behalf of the patient, obtain the consent from the patient, obtain their identity, and support the patient in then accessing their data from their existing provider and moving it to where they may need. And for patients, this is, I think, going to be incredibly powerful. As I think we've all been through the challenges of changing providers, moving, whatever it may be. And so this framework has the power to really, I think, grant a huge amount of power to consumers. I think it's incredibly encouraging that folks like Epic are taking part in this as well. We're really excited to be partnering with the Caring Alliance in really supporting the voice of the consumer, and so are just excited for this future where services like HealthX can support the individual, because I think the challenge in the non-HealthX version of the world with individual access services is that there's still a lot of challenges around user experience, where patients have to log into one instance of their patient portal, they have to log into another instance, they have to go through multiple verifications. And so having the identity piece be a part of these flows can really simplify for patients as they're looking to move their data.
So the T in TEFCA, David, stands for trust, okay? And the core of trust, as you have mentioned, others have mentioned on the panel, is are you who you say you are? And basically, do you have authorization to access this information? Priyanka mentioned that all patients do have that ability and that under federal law to access their information today. But for providers and for payers, it's based on their need to actually see the information. But TEFCA starts to be that kind of great unlock for how individuals prove in a trustworthy way that they are who they say they are on a national network. Can you help us understand how the provider is also an individual on TEFCA? We talked about the digitally native consumer. We could talk about the digitally native provider as well, and how that could potentially unlock, because we've been really huge fans and we're still pushing hard to have identity as being core on TEFCA. In fact, we believe very strongly that TEFCA will not work unless we get digital identity in place. So give us a sense of like, what does that mean for the provider and the different portals they have? And then I'm going to ask Bob a similar question about their providers and what Wellstar does.
Yeah, I mean, I think just in general and more practical terms and bringing it to some of the points that you talked about, right? Healthcare is hard, right? It's not like we get excited about going to go see the doctor in most cases. It's challenging, right, to establish access to your child. It's challenging, right, to establish access to to your parent, for example, as maybe you're the designated caregiver. And so when you think about the intricacies of even some of what we've talked about, it's so powerful to think about what identity can do in those tie-in to proxies, right? I think that's so powerful, and the unlock of the data exchange and so forth. I also think, it's also noteworthy just to even take a step further and talk about some of the real applications. I think about clinical trials and the challenge of, enrollment and aggregating your information and getting into those, and right, like also just not necessarily always being in the right mental state when you're going through that process. If we can make it easier, what a difference, right, that can make. Or something even that we were all thinking about potentially for like life insurance, right, and driving towards like risk adjustment. So there's so many of these like real use cases as we were talking through, but equally as important as Ryan talked about, and I just want to commend Ryan and the Caring Alliance. I think we would not be where we are today if it wasn't for all the advocacy work that the Caring Alliance has done, and Ryan driving a lot of that effort, and all of the varying players as well that have opted into that. It's really exciting to see it all come together, and I've only been at this for a couple of years. I know you've been at it for much longer, so cheers to the group. But from a provider standpoint, right, we think about the challenges of really even a provider provisioning and coming through and onboarding, right? Many times to actually onboard, we have to like physically show up as a provider, or we have to go through some like wonky way of like maybe doing a Zoom visit, which was I think launched actually during the COVID timeframe, where like physical presence wasn't always the easiest way to get through, and you'd have to like hold up literally a driver license and then have all of the varying things that make you as a provider, right? Your license to practice, your diploma. Well, all of those things, right, are kind of that same concept as I mentioned of identities with depth. So if we can tie all those credentials directly to your identity and make it easier for you to onboard, right? What can that do? It can make it easier for you to onboard and actually start practicing. We have a shortage, right, of clinicians and providers across this country, and if we want to continue, servicing the population and making sure we're not, looking at ridiculous wait times, these are the kinds of things that we can help streamline and augment and improve. I think of cumbersome processes. Many of you may not even be familiar with this term, but it's EPCS, electronic prescribing of controlled substances. It is a very cumbersome process to go through to even become licensed, to actually being able to do that, and ultimately a lot of paperwork, and it's fairly redundant, and they do require you to go through that a number of times over the course of times that you ultimately prescribe. And so I think ways that we can help digitally identify, add in the consent components, right? reduce those redundant processes and pull forth those varying credentials that make you who you are. Those are all things that are real that we can do today and really help improve. So I think about the workforce, right? I mean, that's such a critical area of focus for our business. And we think about cyber, right? We just all witnessed some of the craziest cyber incidents that have happened in our time in the past, call it 6 months. And it just goes to show, like, there are a lot of processes that we need to put in place, right? When you think about existing, call it multi-factor solutions, they don't always prove that you are you behind your device. That little green button that shows up on your device, right? Like at some point you get sick of it and you click yes, but you don't actually know, like, was I the one who actually authorized that? Did someone else do that? You've got poor call center agents who, are having to make these critical decisions. Someone who's trying to social engineer, they're pretending to be a surgeon that's calling in and needing access to their workstation. And, they're like, I'm about to go into surgery, I need access, right? Like, we can't rely on these existing processes, especially as we're moving into a more and more digital landscape, and we really need to think about that from a cyber standpoint as well. So those are some of the ways that I think about the provider, getting back into their workstations, onboarding all together, right, safely, and giving them more power to control their digital footprint across all the things that they do as a care professional.
So, Bob, clinicians are consumers as well, but give us a sense of how you're thinking about using this kind of technology with clinicians and digitally native ones that are coming out of med school now.
Yeah, I mean, the digital native healthcare consumers really changing the game. I mean, the expectations are completely different, and they're forcing us to make differences on the inside. So some of the things we're doing there is if we have things like artificial intelligence, we're going to put in remote patient monitoring, we're going to put in telesitter, we're going to put in fall prevention and detection, technologies like that, and as we start to provide more remote services and go outside the brick and mortar walls, we're going to actually have to be able to easily and accurately validate and verify and authenticate. And so these type of technologies and using a digital identity is going to really help in that area because it's dynamic. It's very different than a username and password. A username and password is typically for one system. It's something you have, you put it in, then you go to another system, you put it in. A digital identity is a collection of things that include also behaviors. Your web browser history, it's your personal information in addition to maybe a physical asset, in addition to maybe biometrics, facial recognition, those type of things, fingerprints. So as we can shore up that piece of it, it's going to enable us to actually provide these services with much more distance, much more accuracy. It's going to take some of the workload off of our providers, so there's less pajama time. These are the type of things that this is a framework that all these other technologies are going to ride on. And once we have this nailed down, I mean, it's just going to be endless as to where we can go with it.
So in the few minutes we have left, I want to ask each of you, what are you most excited about over the next couple of years? And as you're thinking about that, I'll start in terms of what I'm most excited about. We did start this advocacy that David mentioned about 7 years ago. It's actually the time when this standard came out called the NIST 863-3 standard, which had this an individual access services, or this IAL, individual assurance level 2, and we made a big push to say we actually need this. Consumers need this, and in order to get consumers the data they need to put that. It was great that ONC put it into TEFCA just about 6 months later, and then now it's now in TEFCA completely. And as David mentioned and Priyanka mentioned, this is the great unlock for consumers across the board. But it's not just for consumers; it's for providers as well. So I'll tell you what I'm excited about is I'm excited about that great unlock. I think identity becomes the foundation for how this is all going to work in the future. And you'll see some of this stuff happen that I believe that identity is going to be in TEFCA soon. And as a result of that, it's the great unlock for providers as well, as Bob mentioned. It's an opportunity to make this happen at scale. I would also say I'm excited about it because these technologies are starting to come together. So huge shout out to Georgia. You can get on, I know I have an Apple device, I know Android is very similar, but you can get on Apple today and get onto the wallet, and you can click add, and you can add your Georgia driver's license to your phone. It's bound to the hardware in your phone. And when you go to the TSA, next time you go through an Atlanta airport, you can say, I don't need to provide my physical driver's license. I can just provide the information that's on my phone, and you can tap it just like you do with Apple Pay, and it'll share it with TSA, and TSA then says, that's it, I'm not going to use it anymore, and then within 24 hours it's deleted completely from their systems. Far more privacy preserving, all consent based, all consumer driven, and all electronic using the best technologies under the planet. You can see the future where it starts to integrate with companies like Clear, where they can use this technology to then say, I'm going to then be able to provide you a Clear account because that's a government issued identity, and then we can start to seamlessly go through that process. So that's what I'm excited about. Priyanka, let's start with you. We'll go kind of around 60 seconds or so for each and see what you're excited about over the next 5 years.
Well, Ryan, I have to say I'm excited that we're having this conversation. When you think about the last 10 years in healthcare and the digitization of health systems, adoption of tools like MyChart, I think we are in this new era where we see that healthcare is going to change a lot with AI, with the pressures post-COVID. And how do health systems establish that trust with their community, which I think is really, we keep coming back to this notion. How do you build those trusts and bonds with your community? And how do you do that as there's increasing pressure to digitize, to go remote, to go virtual? And so this conversation around how you build trust, I think is going to be extremely fundamental in separating out those health systems that are able to provide really patient-centric care. And so I think a big part of that is giving more power to individuals, giving more power to consumers, giving them transparency, letting them understand what does it mean to get my care at a place like Wellstar? What are the choices that I have? What are the choices that I've made? And by the way, you can change those choices at any time. And I think that type of partnership with patients is really going to come to the forefront as we get into this increasingly digital frontier. And I think that's going to be so fundamental in allowing consumers and patients to feel like they're true partners with their doctor, with their health system. And, I'm incredibly excited by the work that I think all of us are doing to support that journey, whether it's around identity, the care experience, and then the work that we're doing to empower consumers around consent, their choices, and what that means for them as individuals. So, I think we're feeling this in all of our lives. Doesn't matter if it's healthcare, and just this notion of trust is incredibly exciting.
Look, I'm biased. I lead healthcare for Clear, so I'm just excited about all the things we're doing in healthcare. I think solving for the fragmentation is real, but I also want to solve for the issues in the airport. So for what it's worth, I will say this, right? I think one important piece that I did not mention today is that, yes, in the airport is a paid membership. Everything we do outside of the airport, though, is completely free to the end consumer, free to the user. So you can be a Clear member without actually having a paid Clear account in the airport. And of course, that's something you can fully opt into if you choose to do so. But I'm really excited about democratizing identity. I think that for so long, we've had to deal with cumbersome ways of proving who we are. We think about, the credit bureaus who own this data and then ultimately sell it, right? Like they've got all this information on us. And honestly, with some of the social engineering that's transpired, like the types of questions they ask, like either I really don't know the answer to it, or you can find it out online. Right? Because like the last question I think I saw was like, when was my parents' home built? And I just genuinely did not know that. But I ultimately found it online. I was like, wow, if I can find it, I'm sure a bad actor could too. So, these are the kinds of things I'm really excited about. For those of you who are unfamiliar with Clear's footprint outside of the airport, I actually recommend if you have a LinkedIn account, you can actually verify your account with LinkedIn. LinkedIn actually came to us a couple years ago and wanted to solve for a major bot issue. They have about 200 million members on LinkedIn, 30 million bots, and we actually really stepped in to help them really bring some of that trust and credibility back to that platform. And we've really seen stunning results in terms of how they've navigated, improved open rates for their consumers, for their members, for LinkedIn users. So really excited to be here today and continue to power the greater ecosystem here in Atlanta. This is a tremendous market, and I'm very fortunate to be here. And also a very cool place, George Aquarium.
Bob, last 90 seconds.
I'll go quick. I see we're running out of time here. So we can't have a talk like this without saying AI about 15 times. So AI is what I'm most excited about. I mean, just the opportunity to do medical imaging and diagnostics and the personalized, health plans, helping the providers actually get their work done during the day, not have to take it into the evening, and have more accuracy, less risk and liability, just repurposing resources for more patient-centric issues and tasks is huge in my mind, and it's going fast, and I don't think we've seen anything yet, but so we're going to have to strap in and get ready for it, but AI I think is going to consume a lot of our time moving forward.
Priyanka, David, Bob, thank you so much for being here. Please give them a round of applause.
Thank you, Ryan.
Thank you.
Thank you.